of the 3 videos, or the 3 concepts that I talked about in prevention, the first one is when you're born, you have no teeth. If you have no teeth, you can have no dental disease, because dental disease takes a tooth surface to grow on. So the first concept is it's a communicable disease. You get it transferred from your parents or your siblings or your grandparents or a caregiver. And that's why the story of, in my 4 decades, I've heard this numerous times, that Billy was the only one that didn't brush his teeth, and he's the only one without any dental disease. Well, that's because all the other siblings used a contaminated toothbrush from a parent or a guardian, and they got seeded with dental disease earlier in their life. So here's my workaround for preventing disease for a lifetime, and this is probably 90 to 95% effective. And that's turn it into a reading experience, a joyful experience for a young child. And that means, instead of saying, go to bed and brush your teeth, you're being punished, the adults get to stay up. Instead of doing that, say, if you behave and get ready for bed, we'll brush our teeth together and read a book. It turns the entire experience around for the child. It's now bonding time with the parent. Now, from age 2 years old on, you get a little stool, you get a little toothbrush, you get your toothbrush, you sit there at the stool or stand there at the sink, and you brush your teeth and they brush their teeth. Then you let them look at your teeth and with your toothbrush get any areas that you missed. And then you look at their teeth and get any areas they missed. And you can do that with one parent or both parents, or with everybody, but you don't cross-contaminate the toothbrushes. That's number 1. Number 2, you make it an enjoyable experience for the child, not punishment. And if you do this, by the time that child is 4 years old, they will brush better than 99.99% of the world's population. If you do that, you will eliminate 90 to 98% of all future dental disease. But when you're doing this, you have to know how to clean your own teeth, or you can't teach early reading skills to children if you don't know how to read. So you need to understand the concept of shoreline or pencil line, or where the gum tissue meets the tooth. That's over 30 inches of linear surface, and most people only miss about 20 inches of that. And that's where all the disease starts. And so if you learn to clean the pencil line around every single tooth, you establish a neural pattern in these children's behavior, and that neural pattern of getting the tooth on the tooth at the gum line. You don't get the gum line clean at the tooth, you get the tooth clean at the gum line. That will be incorporated into their daily activity the rest of their life. And we can talk more in a different video about the pencil line, and about how you get it clean, and about how you have to eliminate dental disease in parents and siblings, or you just transfer it to the younger children. Thank you for coming today. If you found this valuable, please look at others of our short videos.